Hey everyone, and welcome to today's webinar titled Patient Payment Insights and Trends to Watch For in 2023. We appreciate you being here with us today, and we are excited to talk about this topic with everyone. My name is Brooke. I am a junior marketing coordinator here at Mend. Today, I have the privilege of joining Matt McBride, CEO at Mend. Matt, how are you doing today?
Brooke, I'm doing great. I think this is our final live webinar for 2022. So should be a good one.
Fantastic. Let's go ahead and switch over to our agenda. The agenda is rather simple today, but it is packed with opportunities to get paid faster with full automation. Matt is going to take us through regulatory changes, industry insights, and cover how to automate patient payments. Finally, we'll round out today's webinar with a Q&A session. Starting now, you can use the Q&A box at the bottom of your Zoom toolbar, and we'll get to as many questions as we can at the end. Let's go ahead and get started. For those that don't know, text messaging was invented in the UK in the 80s and 90s. It has been evolving ever since, and the laws have had to keep up. Matt, what are some of the recent changes in federal laws concerning texting?
Yeah, and this is a great topic. And Brooke, did you go to the next slide?
Oh, 1 second. Now
Okay, there we go. So, we're going to get into payments today, and some of the content that we have is a little bit of a rerun from past webinars that we've done. But, there were some interesting changes in 2021 that really opened the door to be able to bring in text messaging, bring in new ways of engagement when seeking a payment from patients. So as we kind of take a brief tour through this, we have the Telephone Consumer Protection Act of 1991, which really sought to protect consumers that may incur a fee if they were to receive a call or receive a text or a fax or things like that. It was really to help kind of protect consumers from sales, marketing, robocalls, these types of things, if it might cause the person to incur a fee. In 2015, the TCPA brought forth a lot of important amendments for healthcare. And so these amendments really opened the door to be able to use text messaging in terms of patient engagement for important information about a healthcare appointment. So, reminders, prescriptions, maybe paperwork that needed to be filled out. Those types of things were covered in 2015. But what was carved out and still forbidden around texting was anything related to accounting or billing matters. And so, patient engagement and using texting is very effective. And it's very effective at getting paid, faster and more often, maybe versus a paper statement. But in 2015, those changes weren't quite enough. Well, in 2021, there's actually a case that went all the way to the Supreme Court and basically really diminished the scope of a TCPA of this legislation. And basically, it came down to the definition of what an auto dialer is. And it basically came down to, if an auto dialer is using randomly generated phone numbers, sequential phone numbers, basically, if you're using a phone number that's being generated and not something that's been provided to you, that is considered an auto dialer. And the scope of the TCPA applies. So that really diminished this law and sort of opens the door now to use texting in new ways of patient engagement and billing being one of them. So a very important change. We'll kind of get into this more into the presentation, but these are some key changes that happen that now open the door for a lot of healthcare organizations to leverage in regards to payments or in regards to other information they want to collect from patients.
Let's kick off our agenda with industry payment insights. Matt, what are consumers reporting around their expectations for healthcare payments?
Yeah, so I think we can all relate to this as well, right? At the end of the day, we're all patients, but we're seeing that, I think no surprise that 91% of consumers prefer electronic payment methods for medical bills. Maybe there's a lot of paper that shows up. If we go to any doctor's office, it seems like there's always paper that shows up that isn't necessarily what folks are looking for. Most other industries have adapted modern forms of payment. And so we see 60% of consumers expect their digital experience to mirror that of retail. We've got some other statistics that kind of show where retail ranks relative to where healthcare ranks in terms of payments. And then, potentially folks would pay faster, right? If they, so 45% of patients would pay faster if notified by email, text, or phone call. So if, you make it convenient, you make it frictionless, and you give them a method, a payment method that they expect, a lot of data does point to that they'll actually pay faster. So consumers are really looking for these modern and convenient type experiences.
If I have an outstanding balance, I usually receive a paper bill. The US Bank surveyed over 1,100 people across all 50 states. Matt, what does this data tell us?
Yeah, so a lot of papers being sent. 51% being delivered by paper was actually on the low side of some of the studies that we saw. Some studies said it's as high as 75%. So somewhere between half and 3/4 paper statements are still being sent out. And there's expense to that. There's delays to that. And it's not what consumers want. So there's some better ways. Then we do see that folks are starting to adopt other types of ways to make payments. So whether it be an automated phone call, text messages, going to an online portal, and apps. You can kind of see, the online portals are pretty popular, but generally you get the paper statement first, and then you go to the portal versus just maybe getting some other more modern communication like a text, an email, something like that, and then going and making the payment frictionless. So, those that are using the portals, it probably originated with a paper statement still. So you see that, somewhere we've got, maybe 13 to 16% of the market is an early adopter or using some modern type of payment. But there's a lot of opportunity for others to adopt and sort of catch up, and for texting and emailing and other ways of making payments to become more mainstream.
The US Bank survey also asked respondents about the most difficult payment processes. Matt, what do these insights tell us?
Yeah, we briefly touched on how consumers really wanted healthcare payments to mirror that of retail. 60% of consumers wanted that. And you can really see that healthcare is in a league of its own in terms of being difficult for consumers to make payments. And if you think about, retail and restaurants and some of these other things that we're looking at here, they generally make it pretty easy. You tap, you swipe, you can do it electronically, so you can autofill. Maybe they even keep a card on file. So they try to remove as much of that friction as possible. Where healthcare, it's still, the statement is probably not being sent out to you right away. So it could be coming, several weeks after you've been to the doctor's office. Maybe and statements are coming every 30 days. A lot of times they're very confusing. Then you have to, navigate to a portal or figure out how to pay. And there's a bunch of IDs you have to find on the statement. And so it's no surprise that there are opportunities to improve, patient collections, overall collection rates, reduce AR days. There's too much friction in today's processes for making a healthcare payment. And so I think, consumers are echoing that. And that's why it's really ranked in a category of its own, according to consumers.
On one side, patient satisfaction and retention are very important. And on the other side, healthcare organizations need cash flow to run their operations. What do some of the other industry reports tell us?
Yeah, I mean, here's some interesting trends, right? 75% of millennial patients reported they might consider switching. And there's other data that we've seen, maybe around 45% of patients would consider switching if they didn't have a modern experience. So, that definitely plays into retention. I think we're going to see that more and more with these younger generations, millennial and younger. Then we've got 70% of providers said it takes more than 30 days to collect, when really that could be instantaneous with a text, email, something along those lines. And then 74% said it takes more than one statement to collect. And the statements are not free. The postage is 50, 60 cents. The paper, the time that it takes, there's, maybe some effort in getting that. And then the delays that it takes, getting all the statements, into the post office and mailed out. So, it's really inexpensive to send a text or an email. And it's really what people want these days. So there's a lot of opportunity.
Mend takes security very seriously. We are SOC 2 Type 2 certified based on high trust. Mend is also PCI compliant and follows the NIST framework. Matt, how do consumers feel about security when making a payment?
Yeah, so this particular slide isn't necessarily trying to make the point that, consumers prefer to pay, they, don't ask them to pay by Alexa, ask them to pay by PayPal. That's not really what this slide is trying to convey. I think what we really want to convey here is that you want to use something secure, and then you want to tell your patients that you are keeping their information private and secure. And so, you want to know exactly how any vendors you work with that are collecting payments, you want to know how those work. Obviously, I think why we see the front desk reception at 60% is because, I might be able to insert my own card, or, I can watch somebody with my card, collect the payment, so on and so forth. Doesn't mean that it can't be stolen there or compromised in some way, but, there's more control over where maybe if you're putting something in a kiosk or a smart speaker, maybe you don't feel that is quite as secure and that your credit card information is going to be protected, because we've all had, that transaction that shows up on our credit card statement, or, maybe folks have even had identity theft issues, but we've all had those things pop up where we have a transaction we don't recognize. We have to call the bank, dispute it, get a new card, go through the process of updating all of that. So this is something that consumers are really concerned about. So if you were using a product like Mend to automatically collect patient payments for you, not only would Mend never be able to see or access that credit card number, your staff would never be able to see or access that credit card number, even if somebody wanted to try to take the information. It never touches our system. It never touches any of your systems. It goes securely to an electronic gateway. And so there are, very low probabilities that the credit card information could ever be compromised. And I think that's the point of this slide, is you want to make sure whatever payment solutions you're using, that you're communicating how secure they are, so that there's a level of comfort that the consumer can use the tool, use it securely, and that their information is going to be safe.
Before we move on to the next section, patient financial engagement is relatively new. Matt, what can we learn from early adopters?
Yeah, and so I think what we're talking about when we say patient financial engagement, it's really moving away from the experience of getting a paper statement and having to pay, or getting a paper statement and having an online portal and trying to navigate that. I think what we're really talking about is using text, using apps, using emails, using more modern ways to pay, like every other industry is using. And so we see in some of the research here, 46% of all respondents say that the ROI was immediate. So they saw immediate savings and immediate returns. And if you look below, here are the areas where they were impacted. So 64% of early adopters reported an increase in their collections. How would that impact your business to increase cash flows, in the next 30 days? 55% saw reduced costs, because you can automate a lot of these processes. They don't need to be phone calls. They don't need to be manual processes. They can be automated, and there's a lot of cost to be saved. Even costs of just mailing paper statements can create significant savings. 27% saw reduced AR days. Imagine increasing your cash flow and getting it faster, right? These things would be very meaningful to any healthcare organization. And then, patients saw benefit as well, with it increasing overall patient satisfaction, which makes sense. At the beginning of the presentation, we saw this is the type of experience that consumers are looking for anyway. So it makes sense that this would only further help to drive a positive patient satisfaction rating. So the early adopters have kind of, helped probably develop some of these technologies, and now it's available for everybody in more of the mainstream to sort of start taking advantage of these new opportunities to use patient financial engagement, get paid more, get paid faster, do it at a lower cost, and also see patient satisfaction ratings increase.
It's time for an audience poll question. How do you handle patient payments today? The poll question should be appearing now for everyone, and we'll give you all about a minute to answer. Once everyone is done, I will share the results with all of you, and then we'll move on to finish today's presentation. I see just a few more responses coming through. So it appears that most of you chose patient portal, with close running up paper bills. Does anything surprise you, Matt, when you look at these results?
Yeah, definitely. The portal, and I think maybe having that option to pay in a portal. I wonder if there's texting that's available in the what sort of prompts the person. If it's a portal, are they getting a statement and then they have to go to the portal? What is sort of that prompt to get that payment? But yeah, definitely some interesting results, and maybe some opportunities to have some improvements as we dive into the next section here in the webinar.
Thank you, everyone, for participating, and let's continue with today's topic. It seems that all sorts of businesses are going mobile with payments, for example, the Starbucks app. Matt, what is Men doing to modernize healthcare payments?
Yeah, absolutely. And we're going to get a little into exactly kind of our solution, how it works. Just a couple slides, and um, then we've got I think some other useful information before we get into some of the Q&A here. But basically, what we're able to do is, as soon as that patient's outstanding balance is known, we're able to send out a text and an email right away. And about 90% of text messages are read within 3 minutes. So if you compare that to maybe sending out a paper statement and then relying on a portal, you can see a massive amount of payments same day from that balance being known. From there, the patient can make a payment. They can even keep a card on file for later use. They can put a card on file to be auto charged later on. So, think of like a hotel. You put the card on file, you have your stay, maybe you order room service, you leave, you drop the keys in a box, and they just charge your card automatically. Why can't that be an option in healthcare as well? So either way, we can auto charge or allow patients to keep a card on file for next time. And then any payments that are made, let's get posted right back into the medical billing software so that you have an accurate record for accounting purposes. So very easy, very frictionless, very modern. And I think this is where you can see some of the types of results that we showed on one of the previous slides.
It looks like we have the entire process fully automated for a healthcare organization. Matt, talk us through the patient experience.
Yeah, absolutely. And just to show everybody here a little bit, so we have this sort of mock medical billing software. So if you want to give that a click, Brooke, you'll see that maybe the patient owes $50 here, right? So as soon as that balance is known, we can grab that $50 balance. We can apply different types of business logic. If it was only $2, maybe we don't text somebody. If it's a very large amount, maybe we don't auto charge them, right? Maybe we send them an invoice that they can pay digitally instead. So there's lots of different potential business logic we can apply. And then up next, we can start sending out those digital invoices. And so the patient could instantly receive a text and an email. They click a link. They put in their date of birth. We can capture any consents, and we're going to make some recommendations on consents here in a few slides so they can go ahead and easily accept all of those. And then they're in and they can make the payment quickly, easily, securely, really without any friction. If you want to have more details of the bill, we can attach that. We can spell that out in the form. They can add a new card, put a new card on file, and then they just click complete at the end. And that's it. They've made their payment. From there, we go back to the medical billing software and we record that $50 was collected successfully so that everything can remain in balance for accounting purposes. And it's as easy as that. So just simple, frictionless, easy, really results in what we kind of saw in that class research on how people saw immediate ROI. They got paid more, they got paid faster, so on and so forth.
The patient side looks very user-friendly. Matt, what kind of results are we seeing so far?
Yeah, so what we've seen is 44% coming back within 24 hours, within the same day of being sent out, and then 72% coming back overall. And in some cases, overall collection rates around 80% or higher. So you reduce that friction, remove that friction, and positive things are going to happen.
A 72% completion rate is pretty incredible. Matt, what are the secrets to achieving high engagement rates around patient payments?
Yeah, so I think, not only do we want to, leverage text and email, we want to make sure that the text and email are going to hit the inbox, right? We've all seen and received email or an SMS now that end up in a spam folder. So, first we're going to make sure, hey, do we have a mobile number and do we have an email address? So we're going to look at reachability. Then we're going to make sure that we send SMS in such a way using a short code that we know it'll reach the inbox, that it won't end up as spam. And then for email, we are a certified email sender. So our emailing processes and practices are audited. They're certified by Validity. And Validity communicates out to all of the internet service providers and says, hey, if you get an email from Mend, you can trust it. You can put it in the inbox. It's not spam. So the first is really just making sure that you have that deliverability. If you hit the inbox, especially for SMS and email, if you hit the inbox, 90% are read within 3 minutes within text message, and you just make it easy and frictionless to make a payment, you're going to receive more payments faster. From there, we want to ensure that it's frictionless. So, we have a patented process, link, date of birth, and then you can get in and do whatever you need to do. We don't have any logins, signups, downloads, or anything like that. We can store a card on file, and we even provide instant technical support. So if somebody was having an issue or stuck making a payment, we can actually provide some of that technical support within 20 seconds, just to give you every opportunity to get paid, more often.
We saw in the demo a few slides back that Mend can capture consents on behalf of customers. What is Mend doing to ensure compliance and best practices?
Yeah, so, again, we talked about the TCPA a little bit at the beginning of the presentation. Now we're talking about consents. Just one disclaimer, we're Brooke and I, we're not attorneys. So you always want to make sure that you check with your legal counsel. But, we have done some of the legwork and we do know some areas and we're able to provide some boilerplate consents just to give our customers everything they need to be successful and to follow best practices and to follow all the rules and regulations out there. So, we showed in the demo how easy it is and where we can collect the consents. And we just collect those the first time. But we can collect and recommend consents for text and email, even though, the TCPA was really decimated. It's not a bad idea to get a consent from somebody even though you don't necessarily need that express written consent, but at least getting that and having that on file gives your organization the best legal posture, just in case. So since it's not difficult to collect, we still recommend doing that as a best practice. For payment as well, we have a couple versions of payment consents that we provide to our customers that they can use. And, you might want to do different things. You might want to maybe consider auto charging. That might be a little bit different than sending a digital invoice each time. And then, we might have something for e-signature. We might have something for telehealth if that was included. So any of those consents that you might need, we're going to go ahead and provide those to you. If you're working with another vendor, considering another vendor, these are the types of consents that you want to make sure that you have in place and that you're capturing, just to put your organization in the best possible position, just in case.
Matt, as a healthcare organization, what types of problems does a solution like this help to solve?
Yeah, so we've kind of touched on it a little bit, but we're talking about improving overall collections. We're talking about reducing AR days, so getting paid faster. We're talking about reducing potentially staff time and labor associated with collections, with patient collections. And we're talking about increasing patient satisfaction and retention. This isn't just men saying this. We presented the research from class as well to kind of validate these potential opportunities from early adopters and patient financial engagement. So I think more and more the trend is the consumer, the patient is responsible for more and more of their healthcare out of their own pocket. So having multiple ways to engage with them, having multiple ways to collect is only going to do positive things for the cash flow of any healthcare organization.
Before we get to the Q&A portion of today's event, our audience may or may not know that Mend is a complete patient engagement platform for in-person, virtual, or any type of visit. Matt, can you explain this further for our audience today, as Mend can address more than patient payments?
Yeah, so really Mend is a complete patient engagement solution. So we can really help with your entire patient engagement strategy. So if we're talking about self-scheduling, appointment reminders, being able to confirm or make changes to that appointment, doing forms digitally, paying any balances before the visit, we can actually facilitate the visit. We have telemedicine as part of our platform. We have a virtual waiting room experience. And then we can help with anything after the visit. So sending post-visit follow-ups, maybe surveys, collecting any remaining balances once everything has been adjudicated through insurance. So we are a complete patient engagement platform. We can, one partnership, one integration, we can facilitate a complete strategy and really allow you to put an experience together, whether it be an in-person visit, virtual visit, et cetera.
If you are looking for more informative content, we keep a library in the resource section of the men.com website. We have a highly attended webinar that is now on demand, titled 16 Key Telehealth Learnings to Prepare for Maximum Success in 2023. Simply navigate to men.com, click on resources, and you can access all of our on-demand content there. In our white paper section, we have brand new content titled Patient Payment Trends in Healthcare. For those in our audience interested in this content, just go to men.com, click resources, and then click white papers. And with that, Matt, let's jump into the questions. As a reminder to our audience, Zoom has the Q&A option in the toolbar to make it easier for us to answer your questions. Okay, Sydney asks, in your opinion, why hasn't everyone in healthcare adopted texting options for payments?
Yeah, I don't think a lot of people know that there was a big Supreme Court ruling in 2021 that really opened the door for texting. Texting has always been an incredible way to engage patients. I think most people in healthcare understand that now. And so with that door being open, it's definitely powerful when collecting payments, as well as trying to engage the patient for other matters and other initiatives. So I don't think a lot of people know that door is open, and maybe don't know how to do that in a successful, compliant way. And that's why companies like Mend exist, to kind of help you navigate all of that.
Chuck is asking, are you collecting payments for telemedicine visits or in-person and telemedicine appointments?
Yeah, great question. We have a great telemedicine platform, but All of our other tools work, whether it's virtual or in person, or we have some customers that are doing phone visits, or they're actually going to the patient's location. So it doesn't matter what type of visit it is. Our patient engagement platform can work no matter the visit. And our platform was really architected from the ground up for hybrid care. So for organizations that offer a virtual, but also offer in-person types of care. So everything that we offer can really span any type of appointment.
Carol posted the following question: how do you get patients to opt into text messaging?
Yeah, so patients don't really need to opt in anymore. That's express written consent was something that was required if an auto dialer was being used. The definition of an auto dialer has been diminished. If you're generating a phone number, right? If you've been given the phone number, you need that express written consent. You don't need that anymore. Now, along the way and along the process, we showed you that we still think it's a best practice to collect a consent. If you consult with your attorney, they're probably going to recommend that as well. But you don't have to have that sort of express written consent opt-in, which is kind of a pain, right? To try and get everybody to opt in would be kind of a pain. The door has been open now, and you don't necessarily need that express written consent to be able to send somebody their first text message.
Let's see here. Forgive me if I butcher anyone's names, but NC is asking a question about handling the card processing costs.
Yeah, so let me see. So basically saying that online payments might cost a provider, 2 to 5% in card processing fees compared to a check. And so I think let's unpack that just a little bit, right? You should definitely not be paying 2 to 5% for processing a credit card. I know that there's Stripe and there's some others that charge the 3.5%, but you can get a merchant account. We know merchant accounts that we recommend that basically charge cost. Cost is interchange fees. So these are publicly published fees that are standard, that everybody has to pay for just moving money around between banks. So these interchange fees are less than 2%. And so, you should maybe be paying somewhere between, 1.5% to 2%, or maybe a little bit more. With a payment gateway, they might charge a little something per transaction, but it definitely shouldn't be in the 2 to 5% range. Now, yes, you are giving up some percentage there, and that can definitely impact your bottom line. But the cost of relying on checks is that some people aren't going to write those checks. Some people are going to say, this is silly. This is 2022, or this is, we're about to be 2023. I'm not writing a check. You should be able to pay by credit card. Plus, they may want to pay by credit card to, get points or whatever it is. So I think, the small fee that you would pay, it probably would net more collections and more cash flow to the business faster, giving up that small percentage to just allow people to pay with their debit card or allow people to pay with their credit card, than trying to save maybe 1.5%, 2% that you would pay for the credit card processing.
NC has another question posted here. Do you use a back end partner to post to patient accounts?
I think maybe what the question is referring to is integrating with the medical billing software. And we approach integrations different ways. Sometimes we work with partners that are experts in a given system. Sometimes they're integrations that we've written ourselves. But we have a pretty smooth integration process, and we can stand up an integration pretty quickly with really any type of format, whether it be a flat file, HL7, API. We can usually find some way to automate the process so that we can, receive those outstanding balances, but then when we do collect a successful payment, write that back so that you have accurate accounting. So we do work with some integrators, some of the integrations we manage ourselves.
We have a reoccurring popular question for our webinars. Will they receive a recording?
And yeah, great question. Yes, we will process through everybody that registered and attended tomorrow, and we will get the recording, and we will get the presentation out to everyone. So you don't need to do anything. We'll be sending that out via email tomorrow.
Thank you, Matt, so much for answering everyone's questions. And I think that concludes our Q&A portion for today. Just wanted to thank you all for tuning in and joining Matt McBride and myself today. It's always a pleasure discussing this with you, Matt, and we hope you all tune in again next time.
Thanks, everybody. Happy holidays.
Bye, everyone.